So welcome to the Medical Assistant Information Meeting here at Kellogg Community College. My name is Lori Haley. I am a certified medical assistant. I have been certified for 16 years. I have been an instructor for 9 years. I've been here at Kellogg for 2.5 years as the program coordinator. I will jump right in here. So what is a medical assistant? Medical assistants are usually working alongside the physician, mainly in the ambulatory settings, such as medical offices and clinicals. So you won't normally find medical assistants in a hospital, okay? So are medical assistants on demand? Yes, they are in demand. Medical assistants careers are growing much faster than the average overall occupations. When I updated this slide, it increased from 15 to 19% increase, and that's according to the United States Bureau of Labor and Statistics. So we're predicting the surge in numbers of physician offices and outpatient care, just because the elderly Americans who are going to be needing medical treatment. So our baby boomers are aging and will be needing to be seeing physicians. So job responsibilities for a medical assistant, there's both administrative and clinical duties. So here at KCC, we teach both the administrative and the clinicals. So you might see, you might use your computer skills, learning applications, answering telephone, greeting patients, coding, filing charts, scheduling appointments. And then clinical duties, you will take medical histories. So when you room a patient, you're getting all the vital signs, assisting a physician during exam, collecting and preparing laboratory specimens, which could include drawing blood. And you'll learn that here at KCC. You might also perform electrocardiograms. So lots of fun stuff that we do here. So this is our current lab space. We just got a new lab space. So you'll see the exam table, and it's kind of set up just like you would see an exam room if you've gone to the physician's office lately. This is how you might see the exam room set up. So it's very real, very lifelike. And then the picture on the right, I put a picture of one of our phlebotomy chairs. Those are our new phlebotomy chairs. So it's very exciting. So here I have pictures of current students, or former students. One on the left, you can see them doing the eye exam for distance, and then on the right, doing colorblind testing. And then this is prepping a patient for an exam with the provider. You will get weight and height every time, and then positioning the patient for their exam, depending on what they're being seen for. And then the picture on the left, we have a student doing an ear irrigation, cleaning the ears out so that the provider will be able to see the tympanic membrane or the eardrum. And then the students on the right, they were doing tubular gauze. So I thought it was very fun. So we did a picture of that. All right, so medical assistants are the heart of the healthcare. They're instrumental in helping the patients feel at ease in the physician's office. They often explain the physician's instructions to the patient. So you, as a medical assistant, will need to make sure that the patient understands what's required of them, make sure that they understand any medication changes, scheduling follow-up appointments. And if they're doing any kind of procedures in the office, then you'll be able to help the physician. So do you have what it takes? Can you multitask? Can you follow directions? Are you organized? Are you detail oriented? And can you show empathy and sympathy? And then why should you choose KCC? The medical assisting program here has been designed for the working student with a busy schedule outside of the classroom. So you'll find that all of our classes are taught online with the occasional labs being taught at the main campus. The medical assistant program is fully accredited through the Commission on Accreditation of Allied Health Education Programs, or KHEP. And then that will make you eligible to sit for the certification exam and become a certified medical assistant. And then what classes do you take? So this is just an outline of how our classes work. We go in cohorts. So our cohorts start in the fall. You will see that the medical terminology is listed there on the top. You can take that before being accepted into the program. So you could take that in the spring, summer, fall, depending on when it works for you. And then you will see the other classes, they run this way. So you have to take them sequentially. So you'll see that. And then you'll notice in the summer is the medical assisting programs practicum. And that's when you go into the clinical sites and do your externship. So you have 160 unpaid hours. Moving on. So tuition, there's labs and fees that you'll notice here. Other costs that you might want to consider are books, scrubs, stethoscopes. You'll be required to get a health physical before starting the program. You aren't required to have a stethoscope before starting the program. It's just nice to have your own so that way you can learn, you can start listening and hearing using your own stethoscope. So medical assistant job outlook. So according to the U.S. Bureau of Labor Statistics, this medical assistant is making about $34,000 a year, or $16.73 per hour. This is a typical entry-level education, so it's a post-secondary, it's a certificate, so it's 1-year program. And then you'll notice the total number of jobs in 2019, and then they are projecting a 19% increase. So, and then if you wanted to, you could go to that website and see the statistics. And then time to register. So if you think that you have what it takes to be a medical assistant, Caleb is on here. He is our academic advisor, very knowledgeable. And then you can call and make an appointment with Caleb, or so you can either email or call that number. And I'll leave that up for just a minute if you want to copy that down. All right, so if you have questions, feel free to give me a call or email me. It's the best way to get a hold of me is through email right now. So, and then I'll see you in the fall. So if you are interested in the medical assistant program, my suggestion would first be to make that appointment with Caleb. And then he can go over, I don't know, Caleb, can you speak to what you do when you meet with the students?
Absolutely, yeah. So if you're considering this program or considering this maybe one in a few health programs, because that's oftentimes what I see, students, we'll talk about the admissions processes and we'll talk about making a plan for when you should be getting in. So for example, this program always starts in the fall, and I think that's still correct. Is that true, Lori?
Yes, yep.
Okay, so yeah, it always starts in the fall. So we would just want to make sure that you're meeting all of the eligibility requirements to be able to take courses like have a college level reading level, do our online learner orientation, things like that. So we'll walk through all of that, making sure you're ready for that goal. We can even plan out that medical terminology course ahead of time, so you can have that done prior to getting in, which will just make your life a little easier once you are in. And then once we have that done, I have you reach out to Lori just to express interest in the program. She can put you on her list. And so that way you have a seat slotted then for the fall. So it's really just making sure everything is lined up in an order and fits in with the timeline.
Thank you.
Yeah.
Does anyone have any questions for myself or for Caleb? You can go ahead and unmute yourself and ask questions if you do.
What is like your favorite part of the job?
As a medical assistant?
Mm-hmm.
I always enjoyed working in family practice because there's a wide range of patients, and also minor office surgeries. I always liked performing minor office surgeries along with the physician. But I am a people person, so it's always nice to have new people every 15 minutes that you can talk with, and so it's a fun job, and it's fast paced, so your day goes by quick. So
That's good.
yeah, thank you.
Yeah.
All right. Any other questions? Anyone? No? All right. Well, I hope to see you guys in the fall.